There are about 4,979 cases, 1,680 recovered, 125 dead. Let's focus on this number here. These cases also involve the healthcare workers and the front line in the battle against COVID-19. The health workers have been dealt a major blow by the virus. 87 health workers have tested positive as the country marked 102 days into the pandemic. Now, medics say they still do not have adequate and quality PPEs. This as the country recorded 59 more positive cases in just 24 hours.
Kenya's 1,680 total recoveries of COVID-19, June 22nd, is a success story, but one that has come at a steep cost. 87 healthcare workers, including nurses, doctors, anesthetists, have been infected at the front line.
Healthcare workers equally have been infected. So far, the figures we have is 87 healthcare workers. Nairobi 32, Mombasa 42, those are the highest. That means that if healthcare workers are not adequately protected, then the risk is that you will have more healthcare workers infected, and as a result, then you'll have a lesser workforce.
At the Mbagathi County Hospital in Nairobi, 10 nurses stationed at the mail ward that has a capacity of 50 have been forced to go into self-quarantine after testing positive for COVID-19. Sources intimate to Citizen TV that only 4 nurses have been left to man the hospital and they are overwhelmed. Key demands for the health workers are the employment and deployment of more personnel, safer working conditions, timely payment of salaries, and unveiling the promised welfare package for all health workers.
Unscrupulous county officials have engaged in procuring very substandard PPEs, or you rather not don any PPE than don a PPE that is substandard. Because psychologically, you'll think that you're protected, but you are more exposed than the person who has not donned a PPE.
Any healthcare worker who contracts COVID-19 needs to be isolated from their family. The national government has tried by putting up the daycare center at Kenyatta National Hospital specifically for healthcare workers, but that is lacking in the counties so far, and as a result of that, then the counties need to put in place healthcare facilities specifically for healthcare workers.
In the last 24 hours, Kenya has recorded 59 positive cases from 2,354 samples tested in the last 24 hours. This brings to 4,797 the total number of positive cases confirmed in the country. The total number of samples so far tested is 142,366.
And just because you've seen 59 numbers today does not mean that now the scourge is, going down. Remember that every time you pick a sample, for those of us who have looked at samples and distribution, there is a probability of the type of, samples that you'd get in terms of positives and negatives.
The government is focused on using community health volunteers in implementing a new strategy of home-based care as the caseload increases.
For the home-based care, that we have put stringent measures in place to ensure that we have a robust monitoring and evaluation.
The big question is there enough capacity to deal with the surge of numbers and a growing epidemiological curve? 550 COVID-19 positive patients were released yesterday under the home care treatment. Dorcas Wangira, Citizen TV, Nairobi.